Hello and welcome to Noted. Once again, we're with a very special guest who has so much to tell us, and we have so many questions to ask. And of course, we are now going to join Dr. Sulain Al Khalili. She is specialist in microbiology at the Directorate General for Diseases Surveillance and Control. And welcome to Noted, Dr. Sulain. Once again, thank you for taking this time to join us.
Thank you very much, my dear Lakshmi, and this is my pleasure to be with you, with the audience.
Thank you. Every time we join you, we learn so much more and understand the situation globally. It's exhausting and tiring, like you said, mentally, physically, economically, and to see India, the way the situation India is going through. And overall, for us too in Oman, there are different scenarios we are seeing with this wave. What would you say? What is the current situation?
In fact, this wave is hard toward everybody and toward each and every country. It's not just exclusive for Oman. Oman is not something different than them. We are facing a wave in which there is increase dramatically in the numbers, especially in the initial days, increased number of admissions, ICU admissions, changing in the rate of the age group, for example, admitted to the ICUs, and number of deaths as well. And there are multiple reasons, as we were saying before, even at the early stage of the pandemic. Adding to that nowadays, the fast spread of the new mutant and mutations from the England and from the Brazil, from the India, and so on and so forth.
Would you say in the current situation in Oman, we're also seeing the younger people in their 30s actually being admitted to ICU and sometimes, falling victim to COVID-19? And why is this change in trend? I remember earlier on in the first wave, we were more concerned about the elderly. So is it because they're more exposed?
Yes, they are more exposed. There are so many reasons for this. Of course, we need more data analyzing those people who are admitted at what age group. Do they have any comorbidities? How many of them they are healthy and well and fit? How many of them they are having comorbidities, suspecting them to severe complication of the disease itself. But nevertheless, there is increased number of the younger age from 30s to 50s, and that could be understand. For example, we have the age of 60s and above who got already their vaccine. Also, those people, they are not that much active and they are not going outside for so many reasons. Not going for work or study or such activities. That's why, we have noticed a dramatic reduction in the number of admissions among the age group of 60 years and above because of the vaccine effect, of course, beside the other measures, which cannot be, ignored, of course.
So do you think we should be actually increasing the target groups for the vaccination and include the younger group as well?
That is there from the beginning. The strategy was based on multiple groups and prioritizing the groups. Yes, the elderly, we started on them because the data that time supporting that elderly and the age, as one factor, causing them to have so many severe complications. Yeah. Nowadays, the data is moving in the age group beside the appearance of the new mutated viruses, which are more aggressive in terms of transmission among so many people. So reaching to so many people, whether they are having risk factors or not, that will increase the number of people admitted and people admitted at in ICU and death, of course. So we need to move, of course, in our strategy, and younger age group are included and they are coming provide the vaccine is arrived.
Now, there is a concern, and this is why we're bringing up this question, because this is from our readers and viewers. They'd like to know if there are any group at all who shouldn't go for the vaccination, such as maybe if they have genetical disorders or diseases because of genetics.
Okay. As per now, there is no contraindication in regards to the genetic disorders or, for example, rheumatology, immune suppressed. There is limited data towards specific age groups. For example, less than 18 for AstraZeneca and less than 16 for Pfizer. But even the data for that is coming soon, inshallah, regarding the younger age groups and the safety and efficacy of the vaccines among this age group. The other thing is the pregnancy, and luckily there are strong evidence is coming and so many data are coming that the vaccine benefits outweighing the risk of it, even in the pregnant woman. Lactating women, they are not contraindicated. People with genetic disorder, in fact, they are not excluded. And some of the, authorities in the worldwide, they said that the genetic disorders, for example, they are at a higher level even for getting the complication of the COVID, so they should be prioritized. That's happening in some of the countries.
Okay.
So as per now, there is no contraindication. The other contraindication, apart from the limited data for the pregnancy, for example, and the limited data for the younger age group and the pediatric age group, the people who got, severe allergies like anaphylactic reactions before towards, vaccines, which has the same component of COVID vaccine. Other than this, no, there is no absolute contraindications.
Okay, so it's only for people who have reactions, which has been recorded previously. If not, everybody goes in, even pregnant women.
For pregnant, we are still in Oman, waiting for the evidence, because as we told you before, that we are using it after the announcement of the evidence. It's not once the evidence is, available. No, it's once the evidence is registered and, given the green line from the manufacturers.
So as of now, pregnant women do not receive vaccinations.
Still no, still not.
What do you think are the common mistakes people are making?
This is a tricky question, in fact, and I don't like to blame, for example, or to pinpoint to a certain things, but I will talk about it in general. I will rephrase. For example, what should we have done that will make the process, the entire process of leading this pandemic went smooth and went right? Yes. So I would say that for any public health,
I know, because, in the beginning, we were talking about, breaking the curve, flattening the curve, breaking the chain. Now we're not talking about it. And the numbers are increasing.
This is the point. Coming back and go back and talk about it will remind us that we succeeded previously. By whatever measures and whatever things that we implement at that time, we succeeded at that time to flatten the curve. So it was possible, and it is possible still. Provide that we believe in what we were doing, and provide that we believe in the efficacy of that measures, because it happened before, and it went right before, and it was showing the effectiveness of it. So there is no reason of not believing in that we can still flatten the curve. Yes, we are now in a hard situation. We are now in, harder situation even than before the waves. However, still it is possible, provide that we believe. So this is the first thing that we need to talk about it. Instead of talking about the mistakes, let us talk about the things that we should do. First of all, we should believe that it will end. And we should believe that our choices and our behavior is the influences for this pandemic, is the influences for the waves, no matter how huge is the wave, no matter how hard it is, no matter how fed up we are, for example, as a community or as individuals, still it can be applicable and still we can achieve it. So this is first. The second one is that for the entire public health authority to function well, we need steps. Those steps need to be taken as one unit, so that we can reach to a successful process of public health. That steps include planning, preparedness, assigning missions and responsibilities, implementation and actions, monitoring and evaluation. The other thing is the media effect, which is in promotion, education, risk communication, and risk engagement. These steps, if there is a divorce between any one of them, there will be a disruption of the entire process. So let us, all of us, not just individual, it's not institutes, it is not government or private, it's all of us, the component of the community. Let each one of us apply those steps, do your roles, do your responsibilities wherever you are, no matter what the position of power you are in, your choices and your behavior will matter.
True. So that's the direction we need to, and we can flatten the curve. Another question is, the quarantine is evolving, the rules and regulations. So what should we keep in mind? I think because it's good for us to go back and revise, what we have been practicing and talking about. So now some people can go home to do their quarantine. If they are younger than 18, they can go home, if they're expatriates as well. So what are the things to keep in mind, really? Because should they be in an isolated room within their house, or can they roam freely in the house?
It depends. If it is one person, for example, who come back from travel and who's isolated, or who is infected and isolated among that household, he should be kept in isolation, himself or herself, in a single room without sharing with other people to prevent them, to prevent the spread of the disease in the other family members. However, if it is the entire family, that would be even easier because they can share the rooms, they can share the sitting rooms, and they can share activities as well, and decrease the, depression from being, abandoned yourself alone and so on.
Yeah.
So nowadays we should go back to the same precautions: single room, well ventilated, single room as much as possible, well ventilated. Although it's summer now, yes, and it is hot, you cannot open the windows all the time, but at least, for example, during the evening time, you can do that.
Yeah.
If you are symptomatic, you cover your nose and mouth whenever you are sneezing or coughing with tissue or your, elbow, and wash your hands regularly. Keep and maintain that distance between the family members, even during, within the same house, for example, because those things are the basic things, and those are the same things that we are, need them now in this stage, so that we can, apply the isolation in a good way. Now, talking about the hotels, there are so many other things related to hotels. Do not share, for example, common places like corridors, or going to visit another neighbors in another room of the hotel or another level of the hotel. Do not share the restaurants. Do not share, do not visit somebody else. Do not invite visitors at your room, because there will be no point of doing all of this. It will be a waste of time, a waste of money, and a waste of effort simply. This is the point. And yes, there are, responsibilities on the admin of that place who is accepting people for isolation. But you as a person, you as a family should be careful more than others. To not to do these things, then you will get the disease, then you will spread it to your country, and so on and so forth.
It's holy month of Ramadan, and this is where we usually see a lot of visiting, family members, especially the elders. Now, the movement, would you still say should be restricted, even if it's a holy month of Ramadan? Because that's what the instincts say: is don't visit people, and don't let them, be embarrassed to say no, don't come. What would you like to say?
In fact, because it's a holy month of Ramadan, and because it is one of the instruction of the Islam to prevent people from, having devastating complications of something wrong, because of that, I should ask people to stay home nowadays and do not go for, visitings and so on, because this is a shared responsibility. Now it's the month of responsibility, a month of the commitment from our side. We should, enhance this point of ourselves and our souls because of this month. We should, stick to our Islam regulations. Islam would never say go and visit your families if that will gonna cause, outbreaks, for example, or a cluster of cases. Islam would never say that.
Mm. Correct. And don't take the risk for yourselves and the others as well. What is your message, finally, Dr. Sulain? What would you like to say to all of us?
I would say just, during this hard time, it's very, very, very difficult to be ambitious. However, we always, believe in the hope. We always believe in tomorrow, because we believe in so many good things that we can do. So I would say that whatever, no matter how hard is the situation now, this will end. We cannot say when it will end, but this will end because of each one of us, because of the effort of each one of us. Don't blame, don't stand, don't look at the story and the history behind you. Look forward and work forward with others as well. So this will end. This is the first point. And our choices, our behaviors is the matter. It is the facts which will make this ending become soon as possible.
Very true. And maybe you feel exhausted, maybe you feel pointless in all of this, but there is, like Dr. Sulain said, there is an action plan to flatten the curve, and that includes you, right, Dr. Sulain? It includes each one of us. With that commitment to wearing the masks, especially in public or wherever there are people involved, avoiding gatherings, as well as washing your hands frequently, it's still the same three, and get vaccinated as soon as possible if it is your turn. So that would be our action plan individually for all of us. Thank you, Dr. Sulain. Ramadan Mubarak, and
thank you very much.
more power to you.